right, this is going to be a great video today because we are talking all things birth control. Feels confusing. It can sometimes feel stressful, sometimes even traumatic for people. But what if it's not because you're bad with medications? It could be, and most likely is because nobody has ever sat you down and explained the differences between all of these different versions of birth control. And done so in a way that's clear so that you can really choose what fits your body in your real life. Because the truth is, as clinicians, when we determine which birth control option we are going to give people, yes, part of that depends on what your lifestyle risks are, but a big component of that depends on what you personally feel is best for you and your general everyday life. So how can you make that decision if you don't fully understand the options? Women will sometimes blame themselves and think maybe I'm too sensitive to certain hormones. Maybe my hormones are just messing up or acting up, or maybe I can't really handle birth control on my body. And I'm here to tell you that, ma'am, that is usually not the case. Sometimes it's just that you've been placed on a method that does not work well for you. Now, I'm going to go through all of these methods in this video, but I want you to stay to the end because I'm going to give you what I feel like is a CEO moment type of question that really helps choosing a birth control method so much more simple. I always have to plug in what I feel like is really important for understanding medications, and that is my medication mind map so that you can walk into your appointments with confidence, feeling good about advocating for yourself. Now, if you are new to my channel, my name is Dr. Takova Wallace-Gay. I am a clinical primary care pharmacist as well as an academician. I teach pharmacy and medical students. And here on this channel, I break down medications in plain language so that you feel good about advocating for yourself and making sure that you're choosing and having input into the medications that you are taking. And also, if you don't want to take a medication, so that you feel confident that coming off of it is the right choice for you. Now, I do want to give a quick disclaimer that this is general education and information. This is not personal medical advice. So you definitely need to talk to your medical practitioner, your physician, your nurse practitioner, your physician's assistant, whomever you see, and specifically bring in your medical history so that you guys can come to a decision on what will work best for you. So as I mentioned, we're going to cover a lot in this video today. I'm going to talk through IUDs, both hormonal and copper, implants, the shots, the pills, the patches, the rings, as well as condoms, barrier methods, fertility awareness, withdrawal, all of that. Also going to go through emergency contraception, things like Plan B that can be used, as well as the copper IUD. And we're also going to talk non-birth control uses for these different methods or different treatment options, things like acne, PCOS, endometriosis, etc. I'm also going to go through what happens if you miss a dose, what happens if your IUD comes out, and how do you choose based on your personal priorities. So if there's something specific in this video that you want to see, go ahead and skip to that moment. But if you're here for it all, we're going to go ahead and jump into it. So I have to start by just very briefly going over how pregnancy happens, because I think growing up, we're just taught, okay, if you have sex, you're going to get pregnant. And yes, that is partly true. But number one, only 30% of cycles are successful in pregnancy. So throughout a year, most people have, a cycle every month, a menstrual cycle every month. And if you are having sex at the right time during that menstrual cycle, which is when you would be ovulating, 30% of the time will result in pregnancy. Now, what happens in order for pregnancy to happen is that you have to have an egg released from the ovaries. You have to have sperm from your partner to reach that egg. And then that egg and sperm join together, divides a bunch of times, reaches the uterus, and then implantation can happen. Now, birth control prevents pregnancy by doing one or more of these following things. So 4 different things, generally speaking, that different birth control options can do. 1, it can stop ovulation. So you don't get an egg released at all. 2, it can thicken cervical mucus. If the cervical mucus is thick, it just makes it really hard for the sperm to swim through and actually get to the egg. 3, we can thin the uterine lining. If the uterine lining is thin, that combined egg and sperm, even if it makes it to the uterus, it makes it a less friendly environment, a less cozy environment for that egg and sperm combination to implant. So we can thin the uterine lining. We can also block sperm physically with barrier methods. And so obviously we can do that with things like condoms. So that's really it. Those are the four main things: stopping ovulation, thickening cervical mucus, thinning the uterine lining, or blocking sperm physically. Those are the main things. Now, here's where we get split in different things, and I want you to write this down. Some people want more of a set it and forget it format, and other people don't really care for that. They want something that they can do every day so that they know and can feel that birth control working. So if we're thinking about set it and forget it, those are things like IUDs and implants. These are highly effective because they don't depend on your daily memory. It doesn't matter what you're doing from day to day, implant is there or that IUD is there. Then we've got more user-dependent methods, things like the pill, the patch, the ring, and the shot, as well as condoms and diaphragms and just fertility awareness, knowing what times of the month that you ovulate and things like that. And these can also be excellent, but it really matters what your real life looks like. Are you having a hard week where you're stressed or struggling? Are you dealing with kids and things like that? So I think that matters because that could mean that you put your patch on later, you skip a pill today by accident, you're late with your appointment to go get your shot. And so again, those things are all user dependent. And so online, you will see very often the marketing that says that the pill is 99% effective. And that is true with what we call perfect use. That means you take it at the same time every day, you don't miss any doses. But with typical use, we're looking at more like 90 to 91% effectiveness if you catch up in the most appropriate way with taking that pill the next day or later that day or something like that. Because we know that in real life, people miss pills, refills are picked up late, you're traveling, you got kids, you got work. And so your typical use is going to be different than what we consider perfect use. And so as a general reference, some things to keep in mind is that the pill, the patch, and the ring with typical use have failure rates around about 7%. The shot has a failure rate of around about 4%, condoms about 13%. And again, the long-acting things like intrauterine devices and implants are much, much lower in terms of failure because they don't have that human error involved in them. All right, so let's get into all the different options. I'll start with the hormonal IUD versus a copper IUD. And so an IUD is a really small device that's placed in the uterus by a clinician. Now, the copper IUD is non-hormonal for people who don't want to take hormones or can't for some reason. And how it works is that copper makes the environment essentially toxic to sperm. Some pros of this is that you don't have to deal with, adjusting hormones. It's also long-lasting. And it can be used as emergency contraception if it is placed in within 5 days of unprotected sex. So those are some good things. But some cons or some trade-offs that you have to think about is that the copper IUD can cause heavier cramps and heavier bleeding for some people, especially early on in that process. And that's one of the biggest things that I think people kind of deal with or struggle with. Now, our hormonal IUD is progestin. And so I haven't even talked about this yet, but our birth control options that are hormonal can have estrogen and progestin or just progestin. And so the IUDs, the hormonal IUDs have progestin only in them. And so how they work is that they thicken cervical mucus and they also thin the lining of the uterus. And so that's going to make that environment less conducive for implantation as well as less conducive for sperm to travel. And in some people, they may see a reduction in ovulation just because we do have a slight bump in progesterone or progestin, which kind of affects the other hormones in the process and might reduce ovulation as well. Now, some pros that we see with these IUDs is that people get lighter periods or sometimes no period. Also, it's long lasting, it's low maintenance, so it's easy to do. But some of the trade-offs, or one of the main trade-offs, is that some irregular spotting can happen early on, and this can sometimes be problematic for some people. Some other things that you should know about, but not necessarily be super concerned, but just aware of, is something called, meaning it can come out, it can dislodge and come out. So just be aware of that. It doesn't happen very often, but again, just something to be aware of. Perforation is rare as well, but it is possible during placement that you could get just some scarring or injury during placement. And then infection risk is low, but it is also something to think about anytime we're putting a device, an external device into our body. there's a risk of infection. But again, that's a really low risk as well. Now, if you're on an IUD or thinking about having and it comes out, or you think it moved around or something, let's talk about what you do, because that is real life. That's something that can happen. So first, what are some signs that it has moved or expelled, come out? Number one, you can't really feel the strings anymore, or the strings feel much longer. So if you can feel those strings are a little bit longer, then maybe it has come out of place. Secondly, maybe you feel the actual plastic part. And if you feel that plastic part, it has likely moved or expelled. And then number three, you've got some new pain or heavy bleeding that's different from your usual. That could mean that there's some issues in how the hormone is being released, which could mean that maybe it's moved around or come out. And then, of course, if it actually comes out, if you see it and it actually comes out, would be kind of the fourth thing to think about in terms of, being aware that it has moved or come out. So what do you do in that case? Number one, assume you are not protected. If it has come out, don't assume that you have enough hormone from that device left over to cover you. So make sure that you use backup methods immediately, and then call your clinician ASAP for an evaluation or replacement or whatever it is that y'all determine needs to be done in that case. If you have had unprotected sex recently, just ask about emergency contraception right away as well, just to double cover yourself in case that device had come dislodged or moved around prior to that sexual encounter. Now, the American College of Obstetrics and Gynecology is very clear when they state that if the IUD comes out, it is no longer effective. So again, just to be clear, if it's dislodged or moved around or come out, it's not effective. So you need to go get checked on. All right, the second thing we're going to talk about is the implant. So the main implant is called Nexplanon, and Nexplanon is also Progestin-Only. It's like a little rod that goes in the arm. And this implant is really small. It's placed under the skin of your upper arm, pretty painless, not a lot of issues associated with it. Some of the pros are that it is really effective. Again, it's one of those long-lasting, low-maintenance things. So those are all good things. You don't have to worry about it from day to day. But some cons or trade-offs, again, just like with the IUDs, you might have some irregular bleeding. That's really one of the most common reasons why people discontinue it, just because the spotting can be unpredictable. And y'all know unpredictable spotting is not where it's at. Like that can just cause stress, unnecessary stress, and all those kinds of things. So some people do discontinue and switch to something else because that irregularity can last for a while. So if irregular bleeding is your number one deal breaker, then this might not be your first or your best choice for you. All right, that's all I'll say about the implant. Moving on to the shot, which is our Depo-Provera. The shot is done every 3 months. And some pros of it is that it's convenient. You only have to go get a shot 4 times a year. There's no daily routine or anything like that. You just get your shot, live your life, get your shot, live your life. Some cons is that you have to be on time for those repeat injections. So I've kind of mentioned earlier, if you are late for an appointment or you keep having to reschedule, that's going to be problematic. Also, some people experience irregular bleeding or appetite changes or mood changes. Some people have weight gain on it. So those are things to consider as well. But all in all, very easy option for a lot of people. Okay, now let's go into the pills. There's so many oral contraceptive options. And you can get combined estrogen and progestin, or you can get progestin-only. So let's talk about this. The combined hormonal pills, the estrogen and progestin, are really favorable for a lot of people because you have predictable cycles. At least most people do. They often help with cramps and acne. They can help reduce heavy bleeding and also improve anemia for some people who have been having a lot of heavy bleeding and are now experiencing anemia. So those are all some really good things about the pill. But some cons are that in this combined pill with estrogen in it as well, noting that estrogen is not for everyone. So your clinician will screen you to determine, based on your history, if you're someone who is at a higher risk for things like clotting or other cardiovascular issues. And if that's the case, then likely we would try to be very cautious with using estrogen or stay away from it. And because there are so many different formulations of the oral contraceptives, I want you to note that I'm not even going to get into all this today, but just to briefly mention, we have monophasic, biphasic, and triphasic. And what that means, monophasic is you're getting the same amount of estrogen and progestin every day throughout the entire pack. Biphasic means you get a certain dose up to a certain point, and then that dose changes. And then, which is kind of the most similar to what happens naturally with your hormones, means that you get a starting dose, a secondary dose, and then a tertiary dose. And so the amounts of estrogen and progestin change in the pill as the month goes by and tries to mimic what would happen in your body naturally. Now, it really doesn't matter which one you choose, other than if you have a history and you want to do a lower estrogen option, or if you've had issues on one in the past and you want to switch to another. So that is really person dependent and specific. I do like that the one kind of closely mimics a natural cycle, but I've, personally experienced triphasic and monophasic, and both work well. Now, then we have the Progestin-Only pills. And so these are usually, well, I'll say this first. We have both prescription Progestin-Only pills, but we also have an OTC Progestin-Only pill, which is called the O pill. And that's been a really big deal lately in terms of access to contraception. So you can go and purchase this from many pharmacies. Most pharmacies sell it now. It's called the O pill. So we've got those Progestin-Only. So the pros here is that there's no estrogen. So if you're someone who can't use estrogen right now, then it's going to be a good option. And so I already mentioned that certain people that can't use estrogen are people who, or maybe should be cautious about using estrogen, I should say, are people who have some type of cardiac history or history of clots. But also if you are recently pregnant and now you're breastfeeding, then we're not going to give you estrogen either. So there's some other situations in which Progestin-Only is going to be the ideal option. Now, some cons with Progestin-Only is that the timing is going to matter a lot more. Some of those Progestin-Only pills have a much tighter kind of late window. So if you miss a dose, then you got to make sure that you take it pretty quickly, or you're definitely going to be unprotected for some time after that. So speaking of being unprotected and missing doses, what happens if you miss a dose? And first, it's okay. What concerns people that don't want to take pills is that, what if they miss a dose? And, sometimes people get pregnant when they're on the pill, and usually it's because they've missed a dose or they've taken the dose a little bit too late. It's, not usually because the pills aren't working, because these are very tried and true methods. They work really well. They are highly effective. But again, that is with perfect use. So if you're on a combined pill, estrogen plus progestin, then the CDC has very specific steps depending on how many pills you've missed and also where you are in the pack when you miss that pill. But generally speaking, take that missed pill as soon as possible and then continue your pack. If you miss 2 or more pills, you will often need some type of backup method for at least a week, 7 days. And you might also need to skip that placebo week depending on the timing. So for all of these, really need to pay attention to what your packaging says and follow that. But again, generally speaking, if you miss 1 pill, take it as soon as possible. If you miss 2 or more pills, then just make sure that you're employing some type of backup method. Now, if you're on Progestin-Only pills, including the over-the-counter, this kind of goes into that as well, then the labeling typically emphasizes that that if you're late beyond the window, then you need backup for 48 hours. And so that window is usually pretty short. So again, just look at the package of what you have and make sure that you are either within that window, but if you're beyond that window, then definitely use backup methods. Condoms, you may have to go get Plan B if you've already had unprotected sex, things like that, for 48 hours. Now, something else that's important to note is that different Progestin-Only pills have different late windows. So again, let me be clear, you have to check your packaging to know exactly what you should do for your particular product if you miss a dose, because they all have different types of progestin in them. There are multiple different generations of formulations. And again, not going to get into that today in this video, but yeah, so you just have to be very cautious and careful about which option you have and what your window looks like. All right, so let's quickly talk about the patch and the ring, are also combined methods. So the patch is a combined hormonal method that you change on a schedule. So it's usually a weekly routine instead of a daily pill, which is somewhere, in between the long acting and the pill. You can just do this every week. And this is good for people who forget daily meds. You can just have that one day of the week around the same time that you switch off your patch. But some trade-offs or some things to think about with this is that if you have sensitive skin or things like that, then it could cause some irritation. And also that there is still estrogen in these, so you still have to be screened. And you may be someone who is not ideal for estrogen. The ring is very similar. It's a combined hormonal method as well. It's placed in the vagina on schedule, and these are usually monthly. So we've got our daily pills, we've got our weekly patches, we've got our monthly rings, we've got our every 3 months shots, and then we've got our, multiple years with the IUD. So when we think about the ring, again, it's a monthly routine, so lower maintenance than the daily pill or even the weekly patch. So that's beneficial for people. But some cons or trade-offs is that some people don't really like the insertion or removal because you do actually have to insert it into your own vagina, really deep in there. And then you also have to make sure that you're screening as well because it has estrogen in it so that you're being screened. All right. Now, barriers in non-hormonal methods. I'm just going to briefly touch on this. So condoms are really the main method that also protects against STIs because you probably already know this, but the contraceptions that we talked about, even the ring, although it is inserted into the vaginal canal, it does not protect against STIs. So many people will use dual protection condoms plus another type of birth control method because the condom is what's going to protect against the STI. We do have diaphragms and spermicides as well, but these require a bit more planning and very specific and correct use. So I don't recommend those very often, but condoms are really a mainstay. And then, of course, we have fertility awareness and withdrawal and lactational amenorrhea. So these methods rely on tracking your fertile days as well as your behavior. So they do work for some people, but there is a wide range of typical use effectiveness and everybody's body is different. So the lactational amenorrhea method, when you are lactating or breastfeeding during that postpartum time, a lot of women have not had their period come back yet, or their menstrual cycle hasn't fully started back yet. So if you're considering that, you really want to talk to your clinician and get some guidance about if you meet criteria for that. Because again, everybody's kind of different. I've seen women whose hormones kind of regroup at about 3 months. For me, it was about a year, and I had to stop pumping and all of that before my hormones kind of normalized a little bit more. So it's just definitely something you just need to talk to your clinician about to see if that lactational amenorrhea method is going to work for you. Then we've got, of course, our emergency contraception. Well, before I say emergency contraception, I wanted to mention something else when it comes to tracking. Some people have apps and things like that. Some people can kind of feel it in their body. They know their bodies well enough, what their cervical mucus looks like, what their body feels like when they are at certain points in their cycle. But it really does require you to know a bit more about your body. So just keep that in mind. It may be a little bit of a learning curve to get there. Some people track their basal body temperature, all of that, to see when their progesterone levels are going up and things like that. So just know that it is something that you can do. It just requires a bit more intentionality. All right. And then finally, we've got our emergency contraception options. So this is something that I just think everybody should know, just at baseline, what emergency contraception is, how it works, when do you use it, what does it do? And so to be clear, it's not a regular method. It really is a backup plan. So you shouldn't be going to get plan B after every sexual encounter. Like that's not the goal of it. That's not the intention of it. So I mentioned earlier that you can use a copper IUD for emergency method. It's going to be the most effective, but it has to be placed within 5 days of that sexual encounter. So you have to make sure that you get in for an appointment pretty quickly. We also have the emergency contraceptive pills. And so again, take this as soon as possible, usually within 5 days for most of them. There are different options for emergency contraception over the counter. The one that I have here is the Progestin-Only. The one that I have here is the Progestin-Only pill that's over the counter, but there are some other ones out there as well. Most of them, you have to take them within a 5-day window, and the effectiveness can go down a little bit as time passes. So the big takeaway here is decide which method you think is going to work for you, and don't feel like you're failing if you decide to switch to something else. Figure out what works for you. And sometimes it may take a couple of methods before you get there. Now, I do want to talk very briefly about some non-contraceptive uses for these medications, because sometimes we use these birth control options as symptom control for other things. So I want to expand that conversation into some of those things as well. So the combined hormonal methods can also help with things like acne or excessive facial and body hair in individuals who have PCOS. We also see them used for individuals who have painful cramps during their period. And we also see it used for helping with reducing the heaviness of bleeding and improving iron deficiency anemia risk in individuals who do have heavy bleeding with their periods. And then finally, sometimes we see it used for PMS symptoms as well. In some cases, I haven't personally seen it used this way very often, but it is a potential option as well. The progestin methods and the hormonal IUDs can also support the heavy bleeding and painful periods for some people, but that is very individualized. So you just have to talk with your clinician to see if the progestin-only methods or the hormonal IUDs can be helpful, because the things I just mentioned in terms of acne, less severe cramps, those are things primarily we would use combined hormonal methods for. But if you're someone who can't use estrogen, again, and you need that help with acne or having less severe cramps, then you might be able to use a progestin-only method. So the big thing here is that these are not just birth control. Sometimes these are really helping improve quality of life for individuals who are dealing with alternative or other issues that these medications can help with. Now, I've kind of already mentioned several times during the video that estrogen is not for everybody. So I really want to just expand on that a little bit now. When I say you need to get a history and make sure that someone evaluates you to see if estrogen is for you, for certain individuals who have specific migraine patterns, it may not be the best option for you. If you have a history of clots or have had a major clot or risk factors for clots, might not be the best option for you. If you are in a certain postpartum time window or breastfeeding, not going to be a good option for you. Or if you have certain cardiovascular conditions, it's not going to be the best option for you. So we just usually try to be very cautious with using estrogen in several populations, and those are some of them. All right. Now, once you go into your next doctor's appointment, I want you to ask, which method will I be able to use correctly on my worst week, on my worst day? Not your best week, your worst week, the week where you're doing all the things. You're momming, you're wifing, you're cleaning, you're cooking, you're running late for stuff, you're traveling, whatever that looks like for you, you're exhausted. What are you going to be able to stick to? And for some people, they can stick to the pill during that time. That's not going to be an issue for them. They're very alarm on the phone type people and clockwork. But, other people are, no, I need something that I can set and forget. And that's fine too. You also want to ask yourself, do I want lighter periods, predictable periods, or do I not care? I'm someone who, I think for a long time, I really appreciated predictable periods. It's not that I love having a period every month, but that predictability of it was just kind of mentally comforting, more so than not having a period at all. And so I think you have to ask yourself, what is it that you are looking for? Do you want something that you can stop yourself, or do you want something that you don't have to think about? So with the pill, you can just decide, okay, I'm done taking it. I want to get pregnant now, and so I'm just going to stop the pill. With the IUD, you have to set an appointment, go have it taken out, go through all the questions, all that good stuff. So you just have to decide what type of flexibility you're looking for. And then, of course, if you need STI protection, then condoms need to stay on the team regardless. So, just keep that in mind. All right, y'all, that is it. If this video helped you, please like, subscribe, share it with a friend who needs this clarity or just, needs to hear a little bit of noise in the background about which birth control option to choose as they are headed to their next appointment. And I hope it was helpful. I'll see you next time.